Have you ever wondered why ethics is such a crucial part of medical practice? Well, it's more than just a set of rules to follow. It's the very foundation that ensures trust, safety, and the highest standard of care for every patient. Let's dive into a real-life case that illustrates this point. In the early 80s, a renowned cardiologist faced an ethical dilemma. He was treating a patient with a severe heart condition who desperately needed a transplant. However, there was a shortage of donor hearts. Should he keep the patient on life support, prolonging his suffering, or should he let nature take its course? After careful consideration, the cardiologist chose to keep the patient alive, clinging to the hope of a donor heart becoming available. His decision was based on the principle of beneficence, the ethical obligation to act in the best interest of the patient. Fast forward a few months, a heart became available, and the patient underwent a successful transplant. The cardiologist's ethical decision not only saved a life, but also reinforced the trust and respect between him and his patient. Similarly, in the early 2000s, a group of doctors faced a massive ethical challenge during a flu pandemic. There were not enough vaccines for everyone, and they had to decide who would receive the limited supply. The doctors, guided by the principle of justice, the ethical obligation to treat all patients fairly and equitably, decided to allocate the vaccines to those most at risk: the elderly, the chronically ill, and healthcare workers. This decision, while difficult, was made in the best interest of public health, highlighting the importance of ethics in medical practice. Ethics in medicine isn't just about making tough decisions. It's about protecting patient safety, upholding professional integrity, complying with legal and regulatory standards, promoting patient-centered care, preventing medical errors, and fostering professional development. But let's not forget about the balance between financial success and ethical practice. Indeed, medical professionals deserve fair compensation for their hard work and dedication. However, it's paramount that the focus remains on patient care. So as you see, ethics in medicine is a complex yet vital aspect of the profession. It's the invisible thread that weaves through every interaction, decision, and treatment plan. If you found this exploration interesting, consider sharing this video with others who might benefit from understanding the importance of ethics in medicine. Your support helps us continue to delve into these essential topics. So like, share, subscribe, and together we'll keep learning and sharing. Voiceover. As we continue to explore the importance of ethics in medicine, let's take a moment to consider a pertinent question. Should medical and hospital services be run by large corporations? It's a complex issue with both pros and cons. On one hand, corporate-run medical services can offer economies of scale, leading to lower costs and potentially more accessible healthcare. They can also invest heavily in cutting-edge technology and research, potentially driving medical innovation. However, the flip side of the coin presents a different picture. When healthcare becomes a business, there's a risk that profit motives could overshadow the fundamental principle of patient welfare. The ethical considerations become even more complex. Can a corporation whose primary goal is often to maximize shareholder value also prioritize patient care? Further, financial implications need to be considered. The balance between profit and patient welfare becomes a tightrope walk. While it's true that medical professionals and hospitals need to be financially sustainable, the question remains, at what cost to patient care? In conclusion, while there are both benefits and drawbacks to corporate-run medical services, the ultimate goal should always be the welfare of the patient. It's a delicate balance that requires ongoing dialogue, transparency, and above all, a strong ethical compass. As we navigate these complex waters, we must always remember that the heart of medicine is not profit, but the patient.